Our weekly immigration news roundup is brought to you by the law firm of Figueroa and Associates. For a consultation on any immigration or legal matter, please call 855-768-8845. That's 855-768-8845. For full stories and more immigration news, visit www.theimmigrantsjournal.com. That's www.theimmigrantsjournal.com.
Hello, my name is Mary Campbell, legal assistant at the law firm of Figueroa and Associates, and your presenter with this week's immigration news based on an article by America's Voice. DACA updates. Trump seeks to strip Dreamers of ACA eligibility. Fifth Circuit's ruling goes into effect. Last year, the Biden administration did the right thing by issuing a rule that expanded ACA coverage to nearly 130,000 uninsured DACA recipients. Not only do Dreamers pay billions in tax dollars every year to help fund federal programs like Social Security and Medicare, it makes public health sense because a healthy community benefits everyone. DACA recipients, like all Dreamers, are Americans, plain and simple. The Biden administration said, "The United States is their home, and they should enjoy the same access to health care as their fellow Americans." But in a cruel and senseless decision last week, the Trump administration has announced that it's seeking to reverse this rule and kick DACA recipients who have since enrolled for coverage back onto the rolls of the uninsured and prevent many others from applying. In a statement, the Trump administration's Centers for Medicare and Medicaid Services said that rolling back the rule would ensure that taxpayer dollars to subsidize ACA coverage go only to lawfully present consumers who are eligible to enroll in subsidized coverage through the marketplaces. But this statement intentionally ignores that DACA recipients are taxpayers who help subsidize coverage for Americans. NC Newsline. Each year, DACA recipients work and earn nearly $27.9 billion. Paying federal, state, and local taxes, according to a study by the left-leaning think tank the Center for American Progress. The CAP study found that DACA recipients contribute nearly $2.1 billion to Social Security and Medicare, which they do not qualify for because they are not permanent legal residents. But as the Center for Law and Social Policy, CLASP, said in response to the Trump administration's proposed rule, this isn't about costs or lack of resources, it's about cruelty. Despite Trump's empty words following the 2024 election that we have to do something about the Dreamers, it's Trump who, unsuccessfully, tried to end DACA during his first term. And it's his political allies who have since picked up the baton to try to again kill DACA through the courts. Project 2025, the authoritarian plan to take a sledgehammer to our federal programs, roll back our rights, and target immigrants or anyone perceived to be one, called for running out Dreamers' protections by simply eliminating staff time in order to not process their renewal paperwork at all. Project 2025's chief architect, Russ Vought, now wields immense power as Trump's Senate-confirmed Office of Management and Budget Director and has stated that he wants federal workers to be traumatically affected. But Dreamers will be impacted too. The Trump administration's proposal to strip DACA recipients' access to affordable health coverage is a huge step backward for the well-being of everyone in our communities and further unmasks Trump's transparent and hollow claims to care about Dreamers, responded NILC President Kika Matos. This cruel attempt to undo a hard-won victory for immigrant youth would reimpose unnecessary obstacles that for years kept DACA recipients disproportionately uninsured, preventing many of them from getting life-saving medical care. NILC has and will continue to fight alongside immigrant youth and other allies to bring down those barriers, because we know that all of us are better off when everyone can get quality and affordable health care. As America's Voice research associate and former DACA recipient Una O stated, "We will be unafraid to go to a simple doctor checkup and have the cost break our savings. We can plan out our future a little more with stability, rather than living on the edge." Until a rule is finalized, DACA recipients' current enrollment in health coverage remains the same. Matos continued in the NILC statement. The proposed rule makes clear that this administration will continue to waste time on policies that hurt our families, communities, and collective well-being rather than working to actually make the United States healthier.
Our weekly immigration news roundup is brought to you by the law firm of Figueroa and Associates. For a consultation on any immigration or legal matter, please call 855-768-8845. That's 855-768-8845. For full stories and more immigration news, visit www.theimmigrantjournal.com. That's www.theimmigrantjournal.com.